to do this kind of work, you should be in a very resourceful lab, but most of the time we don't have this kind of resources, and logically we won't be going through this route. So what we can do is we can do virtual screening, or we can do molecular docking, okay, to see if the molecule that is the small molecule that is there in a database of ligands or small molecules, let's say natural product, okay. So natural product are considered to be less toxic, right? So if you want to find natural product which can have similar kind of binding affinity, and if you want to search a large database of natural product, what you can do is you can see if using molecular docking if they can fit inside the pocket and give you some kind of similar binding affinity or not. Okay, so we can predict the binding affinity by using molecular docking. So let me just tell you what molecular docking is. Okay, so let's see what is molecular docking. Molecular docking is a technique to predict the ideal orientation, affinity, and interaction of a ligand in the binding site of your target protein or enzyme, right? So three things it gives you. One is the orientation, two is the affinity, okay, and three is the we can do interaction analysis also. So three things it gives you. So when you have this three thing in your hand, so you know uh, molecular docking becomes very useful, okay, it becomes very powerful, right? Let's say this, consider this as the natural product database. Let's say this has thousands of molecules, let's say 10,000 molecules. So if you consider like doing experimental studies, your resources should be, you should have a very rich resources in your lab, but I wouldn't go through that route, okay, because it will consume all the resources and your time also. So what we can do is we can do molecular docking. We can take one molecule at a time and do docking. Docking in a sense, we are going to see how it fits inside the active site pocket and how it orients, uh, you know, if it can orient similarly with the drug molecule or the reference molecule present there, or if it has the same binding affinity or less or more binding affinity than the drug molecule. Okay, so we can take this reference or the drug molecule out and do redocking and see what is the binding affinity, okay, right? So some score will be given, right, when you do molecular docking. So with this score, we can now calculate the score of all these ligand in the database. Okay, so we can list out all those molecules from the database which is having similar score with the reference drug molecule or higher than the reference drug molecule. So we can look at those top scoring molecule. You can see their interaction also, how they interact at the active site pocket. So if you understand your drug target and what you are looking for, so let's say if I I would be, you know, looking for interaction at the cat- catalytic residues, okay, near to catalytic residues. That means if you are trying to block the active site pocket, or you know the you are trying to inhibit the molecule, the drug target, that means you should be able to block the, you know, interaction between the this catalytic residue with your substrate, right? So this should be blocking the catalytic residues. And also if you can compare with the reference molecule how it is interacting, you can also look at your top scoring molecule and see how they interact, and see if they have similar interaction as the reference molecule. Okay, based on that you can choose out of the top molecules some few molecules, best molecules, and then again you can perform your experimental studies, or before that you can also do molecular dynamic simulation studies. So this molecular dynamic simulation studies can also, you know, do rigorous evaluation. So when you do MD simulation, you can also see how stable is your interaction at the active site pocket. So those which are having positive results from MD simulation, you can go for, you know, testing using experimental studies. Okay, so based on the flexibility, we can again uh, classify docking into rigid docking, rigid receptor, and flexible ligand docking. Or if you are keeping both the receptor and the ligand, then you call it as flexible docking. Okay, so both receptor and ligand you are keeping it rigid. Nowadays we are not using this much. Okay, so it is very fast. It's very good for high throughput screening. When you have large database of ligands, you can use this particular type of docking, but this is very less accurate. Okay, so when you allow the ligand flexible,